Hello, everyone. My name is Nami Puli. I am a registered nurse in Florida. Today, I am going to talk about nursing delegation. What is delegation and when it happens? According to American Nurses Association, the National Council of State Boards of Nursing, delegation is the transfer of responsibility. Nurses often delegate a task to their assistant. Measurement of patients' daily weight is one example of delegation. Delegation occurs when one's tasks are outside of their routine assignments. Who is involved in delegation? Patient care team includes several positions. In clinical settings, the delegation occurs between advanced practice registered nurse, licensed practical vocational nurse, and assistive personnel. Why is delegation important in nursing? Recent changes in healthcare. This is due to increased number of patients, increased patient acuity, and a limited numbers of RN. Requires team nursing. Success in delegation enables the team to provide safe and effective patient care. How delegation works. Delegators are those who delegate responsibilities, and delegatees perform the tasks. In this process, delegator must ensure that the delegatees are competent. It might require additional education and training for delegatees to perform certain tasks. If registered nurse is going to delegate assisted personnel to take patients' manual blood pressure, he or she needs to ensure that the delegatee can perform the task safely. The type of tasks must meet certain criteria set by state board regulation. These are some of the criteria that we need to consider in state of Florida. Specifically, I'd like to point out number 1 and 4 on the slide. The task must be within one's scope of practice. For example, only registered nurse can do patient admission. The task cannot be delegated to an LPN or assisted personnel. Number 4 here says the task can be done under established procedures. As a nurse, I can direct assisted personnel to take patient blood pressure. First, with automated machine, if it's out of normal range, they can retake it manually and report it back to me. These steps ensure delegatees what exactly they are doing within their scope of practice. We must acquire skills and knowledge to be a successful delegator. First one here, we must be familiar with state and organizational policies. It will ensure that we delegating the task that is within delegate's scope of practice. Number 3 here shows one of the most important skills required for both delegators and delegatees. Yoda-wise stated that we must maintain a two-way communication. This will ensure that we are both on the same page. At last, I am covering the 5 rights of delegation, which is the most common tool used when nurses delegate. First, we must know the task is right to delegate. As described in previous slide, we will make sure that by knowing policies. Number 2, the right circumstance. It might not be the right circumstance to delegate to obtain patient's physical assessment when their condition is not stable. Number 3, the right person. Only nurses cannot administer medications. Delegating the task to assisted personnel is inappropriate. Number 4, right direction and communication. I also mentioned this in previous slide. Utilizing a two-way communication enables both delegators and delegates to be on agreement of transferring responsibilities. Number 5, right supervision. The steps I described in the Florida State Board regulations slide ensures delegates what exactly they're doing within their scope of practice. Utilizing established procedure help delegators to supervise the task is performed correctly as well. Checking those key questions enables us to provide safe and effective patient care. We can learn to be successful delegator. Thank you for watching.